And Senate Budget Subcommittee number 3 on Health and Human Services. To my left is Ellen Corbett, the senator who chairs Budget Subcommittee number 3. We also have Mark Leno, the chair of the full Budget Committee, with us right now. There are a few other members who may be joining us as we progress with the hearing today. Today we're going to be looking at early childhood education, at child care, and basically how the state interacts with children from 0 to 5. We know from many studies that the better job we do at working with very young children from 0 to 5, the more likely they are to be successful, and frankly, the better off the state will be in the long run. We're going to hear from several witnesses on different topics. As you look at today's agenda, we will have public comment at 2 different portions of the agenda. When we finish the section on early childhood education and poverty, and we hear an overview of child care and development, and then the Department of Social Services testifies, we will have public comment basically on the Department of Social Services testimony. Then we'll have the Department of Education testifying later in the agenda, and we'll take public comment on the Department of Education testimony. I'd like to turn over now to Senator Corbett for opening comments.
Thank you very much, Senator Block, and thank you for joining in this coordinated effort, very important effort for our subcommittees to hear about early childhood education and its impact on the future of the state of California. As we know, our child care system is a little complex from time to time, but I'm looking forward to hearing from the speakers and the departments to ensure how we can better coordinate our efforts and make sure that we have the most efficient and quality educational programs available for our children, and also, of course, to make sure that we have the support for parents and families as well. And I'm looking forward also to listening to the experts today, and I think we will have a very, very interesting hearing. Thank you very much, Senator Block.
Thank you, Senator. And our first panel today is actually one person, a presenter with very impressive credentials. Dr. Jill Cannon is a policy researcher at the RAND Corporation and a professor at the Pardee RAND Graduate School. She was previously a policy fellow at the Public Policy Institute of California and previously served as the Associate Director of Child Policy at RAND and Associate Director of the Promising Practices Network on Children, Families, and Communities. Her research includes studies of pre-K experiences of children of immigrants, home visitation programs, early grade retention. She's also conducted cost and outcome analyses of early childhood interventions and early achievement gaps among California students. She'll be giving us a 7 to 10 minute presentation, and then there'll be questions from the senators. I'd like to welcome Dr. Cannon.
Thank you, Chairman Block, Chairwoman Corbett, Senator Leno. Thank you for the opportunity to testify today on the research evidence for early childhood programs. As Chairman Block mentioned, I'm with the RAND Corporation, which is a nonprofit, nonpartisan research organization that's headquartered in Santa Monica. And I've been studying early childhood educations for the past 15 years, with a focus on how early childhood policies and programs affect child outcomes. Today, my testimony will draw upon 2 decades of research that's been conducted on this issue at RAND. Policymakers are interested in understanding if and how to invest in the earliest years to improve child outcomes in both the short and the long run. Brain science shows that the first years of life are important for shaping the neural networks that were responsible for key functions. And the earliest years are a critical period of cognitive, social, emotional, behavioral, and physical development. And this process of early development lays a critical foundation for school readiness and later life outcomes. We know that gaps that are present in school readiness skills at kindergarten entry are precursors to later achievement gaps, and that these school readiness gaps have earlier roots. Early childhood investments are increasingly viewed by policymakers, educators, and practitioners as an important opportunity to mitigate the disadvantages that some children face. I will begin by providing a broad overview of the research on the effectiveness of early childhood intervention programs birth to age 5. A significant body of research does establish that a diverse set of early childhood programs can improve outcomes for children and generate savings to government. A RAND review of programs that have been rigorously evaluated indicates that there are 3 general strategies for interventions among these programs. The first is home visiting or parent education. And for those of you who may not be aware, home visiting programs in this context, they provide a series of visits to families who have young children, maybe even as early as prenatal, to talk about issues such as child development stages or health issues that the child may face, but also to support the families and to offer referrals to families to resources in the communities that may help them better function. A second strategy is a combination of this home visiting or parent education with early childhood education or preschool. And a third strategy is preschool only. For decades, researchers have been examining the impact of these three strategies for interventions on child outcomes. From several studies that have followed participants over many years, and most of which did use experimental research designs, we know that high-quality programs that invest in the years from birth to age 5 can have short and long-term benefits. The short-term benefits have been the most studied to date. Studies have found positive program effects for several outcomes in the early childhood period before formal schooling begins, so before kindergarten entry. And these include, as listed here, increased IQ, improved behavior, improved social competence, improved general health status, increased immunizations, reduced child abuse and neglect or child maltreatment, and improved school readiness skills such as pre-literacy and pre-math skills. A more limited set of studies have also followed children into the school-age years and into adulthood. For example, some of you may be familiar with the Perry Preschool Project that's followed a small group of children in Michigan to age 40 at this point. And then there's the Chicago Child Parent Centers, for instance. They're operated by the Chicago Public Schools, and they followed over 1,000 children so far to age 28. Studies such as these that have followed children longer term have also found positive outcomes in several areas. In the school age years, we see higher achievement test scores, and this is in K-12 period I'm talking about, reduced grade repetition or grade retention, reduced use of special education services, reduced teen pregnancy, improved grades, and higher rates of high school completion and higher college attendance. And then looking into adulthood, we see higher rates of employment, increased earnings, improved health, reduced use of social welfare programs, reduced use of tobacco, alcohol, and other substances, and reduced criminal activity. These improved outcomes have been found across varying program dimensions. They've been found in both programs that target specific disadvantaged children who are thought to be most at risk and could benefit from a program, as well as programs such as Universal Preschool that may be offered to all 4-year-olds in the community. They've been found in programs that serve different age periods within the 0 to 5 age span. And in both small-scale programs, such as the Perry Preschool Project out of Michigan, as well as the larger-scale public programs like the Chicago Child Parent Centers and Oklahoma's Universal Preschool Program. The diversity of the programs and the outcomes that they target emphasize that one size does not fit all with early childhood investments. A portfolio of programs can serve children across the age span and to address different goals. However, I want to make an important caveat to bear in mind that not all early childhood programs are expected to be equally successful or effective, nor do all programs improve all the outcomes that I noted here. There have also been several cost-benefit studies that have monetized the benefits of these programs and compared them to program costs. The Perry Preschool Program, again, they followed children longer, generates $7 to $12 in benefit by age 40 for every dollar that was invested in the early childhood period. But that's a small-scale, high-intensity program that was conducted over 40 years ago. A more real-world example of expected benefits from a larger-scale program, the Chicago Child Parent Centers, also generates $7 to $11 in benefit in adulthood for every dollar that was invested in early childhood. RAND has also estimated that the economic returns from a universal preschool program in California would have a positive impact. And we find a similar story for benefits outweighing the cost for home visiting programs as well, with a higher benefit cost ratio for the high-risk families compared to the lower-risk families in one of the programs. These returns indicate that investments in preschool and home visiting have the potential to save the government money in the long run. Thus, the first generation of research focused on answering this yes or no question. Can early childhood investments improve child outcomes? And the answer is yes. A diverse set of models can improve outcomes for children, and benefits can be seen well into adulthood. In many cases, we see that disadvantaged children can benefit more from these programs than the less disadvantaged children. Today, the question has moved beyond merely whether or not early childhood programs can make a difference, and researchers are seeking to identify now the most effective ways to intervene, and for which groups of children certain interventions might be more successful. Because the majority of children are now enrolled in some sort of preschool environment, in California it's about 2/3 of 4-year-olds and about half of 3-year-olds, and many children actually experience non-parental care even at earlier ages, the research agenda is shifting. It's shifting to focus on comparing the effectiveness of different early childhood models and implementing them with large numbers of children in order to achieve the same benefits that we've found with these other proven programs that have been high quality or higher intensity. For example, the RAND California Preschool Study found that early childhood education is often not at the level that has been experienced in these high quality programs, and researchers are trying to determine which features are most important to ensure the greatest benefit per dollar invested. Another benefit of high-quality early childhood programs is that they have the potential to alleviate poverty. As I noted, long-run outcomes include higher educational attainment, higher earnings, higher employment rates, as well as reduced use of social welfare programs. This is consistent with research on investments in human capital early in life. As noted by Nobel laureate economist James Heckman, skill begets skill. So building a stronger foundation for learning in the early years is expected to pay dividends far into the future. These early investments can have higher rates of return than investments later in the life course. To conclude, early childhood investments in high-quality programs have the potential to generate positive outcomes in the short and the long term, and in multiple domains such as school readiness, educational progress, and reduced poverty. And these early childhood investments have the potential for the benefits to exceed the costs. However, as I noted, not all programs will produce similar results, and no single early childhood program is a panacea for early childhood disadvantage. But in total, I would recommend that you support funding early childhood, high-quality early childhood programs, and identify the goals and outcomes you are seeking from these investments to help determine the best program to achieve desired outcomes. The research shows that making early investments as a prevention strategy has the potential to mitigate the need for remediation later in the life. Thank you for the opportunity to testify on this important topic, and I look forward to taking your questions.
Thank you, Dr. Cannon. I'll start with one question. You had mentioned that there are certain factors that tend to make high-quality early education or childcare likely to have greater long-term benefits. What are some of those factors?
So keep in mind that these were smaller scale, higher quality, higher intensity programs that have been evaluated in general. The research tends to evaluate the program as a whole, so it's a little bit difficult to disentangle what the specific components are. That said, I think we are at the stage where it's an extremely important question is trying to figure out what are the quality components and what's the minimum quality we need. There have been some indicators that having a smaller, child to staff ratio, having smaller group size are important, or having more intensive programs. But when I say intensive, we're still not sure what intensive means. Part day, full day, how many months, how many years, 1 year, 2 year of preschool, for instance. Better trained caregivers seem to be important, but again, there's debate about the degrees and the credentials that are absolutely essential. Although some education in early childhood education does seem to be, beneficial. And then it's thinking about this workforce, if they don't come in with credentialed degrees, there's a lot of in-service training potential. And so we're in the process, I know, even at RAND, in conducting a study and trying to think about what are the quality improvement activities that matter most. So for instance, there's research on coaching, one-on-one coaching, and providing in-the-moment, on-site advice to teachers to improve the quality of their instruction and improve child outcomes, and that has some promise. A lot of these programs I mentioned as well are combination programs, so it's not just preschool. It was preschool that offered a parent involvement component, like in Chicago, or weekly home visits in the Perry Preschool program. The Carolina Abecedarian Project, another long-term one that people talk about. That was full day, year-round for 5 years, and it has some impressive outcomes, but it was quite costly. I think that the factors that are most likely to matter are more costly, which you may not want to hear, but that having higher quality teachers requires paying and attracting them to the workforce. More intense programs providing more services are more costly, and then thinking about the teacher supply and the workforce issues.
Okay, thank you. Other questions? Senator Leno?
For your presentation. Thank you for your presentation. You had mentioned that in studying and tracking the Perry preschool and Chicago models, that there was a return on a dollar investment in the neighborhood of $11 or $12.
Up to. Right.
Up to. And that Rand also had done some studies that showed a benefit, but you didn't give any range up to in dollar amount. Was it the same?
For the universal preschool, the conservative or the general is about $2 return for every dollar invested.
Why would there be that differential of 2 to 12?
Oh, great question. So this is more about universal versus targeting disadvantage. So if we expect disadvantaged children to get a greater benefit from these programs, then there's more cost to be saved down the road for those particular families. Universal, there are some families who you would be benefiting from the program, but who probably were going to do well later in life already, and so you weren't going to save as much cost because they weren't going to generate as much cost later. So I think the expected returns per child will be lower for a universal program, for a universal preschool program. I mean, it's interesting, another way to think about it is that from what we know from well off the upper 20% of the income levels nationally, there is almost universal preschool for families that are at the higher income levels. Almost 90%, I think, attend some form of preschool. So it's really targeting the disadvantaged families who aren't participating in it is where you would start getting...
There's more fertile soil to till.
There is.
Right.
And these are outcomes. I want to also make the point that we have to have these long-term studies to really generate... I mean, short-term studies can also generate positive benefits to cost. To get these larger numbers, it's when you get to adulthood and your reduced use of social welfare programs and really reduced criminal activity is a huge area of savings, and higher tax receipts. So that it's in adulthood when you start getting these really large benefits that can outweigh the cost. And a lot of these programs just haven't followed children long enough to see that.
So you've somewhat answered my next question, which was, could you break down how a $12 benefit would be reached? And from what you've just said, it's not just additional tax revenues because people are better employed. It's also the savings that the state will not be incurring. That's a part of that $12.
So there are benefits to the participant and to the government and the rest of society, like reduced crime is beneficial to society, but the government has reduced criminal justice expenditures. But even reduced special education use, which can happen in kindergarten through third grade, could be a potentially really big savings to government in the shorter term as well.
For purposes of our debates, unfortunately, and I don't disagree with anything you've said, and I'm all for investing as much as we possibly can in early care and education, and it is heartbreaking that we have cut the $1 billion or more that we have in recent years, and we're all as eager as we can be to find a way to begin to restore some of the damage that we have created in recent years for all the reasons, most specifically for the benefit of the child who will become an adult, and for his or her families and his or her communities, but also from a public policy perspective, the benefit to the state. Unfortunately, we don't really do that much long-term planning. 40 years is a long time. It's an infinity for us.
But I'm saying to third grade.
Well, that's what I was... It'd be beneficial for us to know more clearly the immediate or short-term benefits as well. I think we can grasp conceptually the long-term, but to know nuts and bolts, dollars and cents, that a dollar today could mean so much in 2, 3, 4 years.
Right, and so that's thinking back to some of the. So if you're willing to go as far as 4 years,
sure,
you can start thinking about reduced grade and reduced special education use. So those can be those, and so I don't have dollars to attach right now for those, but I think those are where you could get some really significant cost savings. Even just one child averted saves you another year of education for grade retention.
And I think this also plays into the conversations we've had and the focus that Attorney General Harris has put on truancy, because without these kinds of investments, sometimes a child's future is almost carved in stone by second or third grade.
Well, I don't want to say carved in stone, but I know that we see kindergarten entry, that the groups of students who start out behind are still behind in third grade. I know that there's been a PBIC study that has looked at being able to predict passing the high school exit exam as early as fourth or second grade, from what you know. And we see income gaps on cognitive skills as early as age 2 or even age 9 months. So I don't know that you have to wait until second or third grade even to start seeing some of that.
I think some of your efforts suggest that the achievement gap is already in place by kindergarten.
Yeah. I would say yes. We don't have achievement test scores in kindergarten, but the other indicators that we have show some pretty significant disparities at the school door. Yeah.
Thank you.
Thank you, Senator Leno. Senator Corbett?
I was just curious. I know we weren't able to locate any, but do you know of any studies, California studies, that show early programs such as these and their impact on students as they progress through K through 12? And
Yeah, I thought about that as well. I would like to give you that info. Not that have followed children longer term. There might have been some national models that are in use, like nurse-family partnership, home visiting, or something that California also uses, but that's not a California-specific program. There was an unpublished study that was done for the First Five Commission, I believe, that did look at the California State Preschool Program and showed positive short-term, school readiness skills improvements, similar to what we see in other state preschool programs.
I just know I'm one who's very frustrated who year after year see these statistics that certain populations of children are not succeeding. And we just read these statistics year after year. And I think that these sorts of programs would go a long way to change those numbers. Could you tell us a little more specifics about characteristics of a quality preschool program, maybe a little more
So it was part of, right, well, I was trying, and maybe poorly, to address Chairman Block's questions about that is staff-child ratio, group size, teacher training, in-service training, intensity of services as well. I think an educational focus rather than a custodial focus is a key differentiation between preschool and childcare at those ages. But I think learning also occurs in the 0 to 3 childcare space as well. It shouldn't just be reserved for preschool. So some of these should trickle, these characteristics would trickle down.
And also, could you tell us a little bit about what a successful home visitation program would look like?
Yeah, so that's another one where we've tended to look at the program and yes-no question rather than disentangling the specific factors within it. But the U.S. Department of Health and Human Services has this home visiting evidence base where they've collected, and in part because they're choosing evidence-based models that the federal government will fund across states. And I think there's 14 of those now, I could be wrong. But in looking across some of the characteristics of those evidence-based models that they've collected, there tends to be a focus on a minimum requirement for the frequency of visits. So what that minimum requirement is varies. But something where you are setting out, we will do weekly visits for 1 year, or we will do biweekly visits for 2 years, or 40 visits per year. So there should be some dosage, although there are some programs that have more of a, I think, predominantly health focus that might just do the postpartum health visits for a very short period of time. But the ones that are really trying to engage the family and focus more on the child development and the parent-child relationship tend to be nurse-family partnership or other ones 2 to 3 years, and with some regular frequency of visits. There tends to be a national association or some sort of organizing entity that has the model and that those who are implementing it are responsible to, and so that they can sort of monitor fidelity, because fidelity to the model is another issue with all of this. It's just having a research rationale that, oh, that program worked, I will now use it, and we will get the same results, doesn't always translate well. You want to make sure that you're focusing on the implementation of the program, the frontline workers, the fidelity to the model. So having a national entity helps with that a bit. There's also a need for the supervision of the home visitors. It's a very tough job. And there can be a lot of stress of going into a home that may not be safe. There's safety, there's ethics, there's boundary issues. And so having a clear supervision over the home visitors helps support them in their role so that they don't get burned out. But then you also need to pay attention to the supervisor and the manager, because we found in a program in New Mexico that could be a problem, that they're overworked, and that's not good for anybody. Pre-service training that you need before you go out and do a home visit, you need to be trained in the model. So that's, I'll say it, even though it seems like a given. Minimum education requirements for staff, even though those vary as well as what the minimum requirements are. But whether or not there's a formal curriculum, there is some sort of specified activity, that, list of activities that you should be doing. Sort of, in the first 3 months of visits, you should be trying to focus on these issues, and later on in the developmental. So some sort of core list of content and activities for each of the home visits is also something that these programs seem to share. But I think other issues that we've come across, that not published as much, outreach with the community. So when you're scaling up one of these programs, one of the first things you have to do is build trust in the community that parents want to even come into your program, because you're asking them to engage with you and go into their home, and that's not necessarily easy for a lot of families to allow. But you're also referring to resources in the community. So you need to build up, like, who if I discover domestic violence, who do I refer these families to? If I discover maternal depression, is there somebody to refer them to? How do I get them those resources? Or what's the point of doing that? So there needs to be some allowing of scale up and outreach in the community at the very beginning, and give the program time to get up and running and full steam before you really try to assess whether or not it's effective. And then the debate about, should you start prenatally? Should you start only with first-time parents? Should you start only with at-risk parents? Different models have tried it different ways, and there's been success across different types of models. And so I think that's a decision the state would have to face. So who are the groups of children that we care most about, that we're trying to serve with this program? Or do we want this, every parent could benefit from getting some advice when they're a new parent? Maybe it's a universal program, but you would maybe expect different returns for that.
Well, thank you, Dr. Cannon. I really appreciate your presentation today. I think it's extremely important for our analysis of how we impact the success of our students in the future and impact the economy, and even, as you pointed out, save some money so we can invest them in other more important programs as well. So thank you very much.
Thanks, Senator Carper. One more question, if I could. Some of the early studies of the original Head Start programs showed that children did have gains, significant gains, that sustained only for 2 or 3 years, and then after a few years, they tended to go back to the pack. Are we doing better with sustaining the gains? And if so, what are the elements that are effective in doing that?
Right. I think this fade-out issue is an important one. We've noticed it even in the review of programs that we did that were beyond Head Start. You get these, really large immediate cognitive gains, and that some of them will fade out. But even in the Chicago, which is a more, large-scale program, as well as preschool, those gains did persist. They got smaller, but even in 8th grade, they were still persisting. And if you're focusing purely on cognitive gains and they fade, you might want to also think about things like, reduced grade retention, reduced special education use, or the fact that even in the programs where the gains faded on achievement test scores, there were still higher rates of high school graduation or higher rates of college attendance. And so there are some other factors at play here besides just the cognitive gains. And I know the Head Start impact study has been quite controversial because of it showing that gains fade. And so researchers are trying to, I think, tease apart why that might be right now. Quality varies dramatically across Head Start is one explanation. It's also that Head Start's kids aren't in the Preschool Project compared kids in a high-intensity intervention program compared to kids who received nothing. Today, most kids, the counterfactual isn't receiving nothing. There is some sort of other type of care that they're receiving. So Head Start's being compared now to, for instance, state preschool programs, which can also be improving benefits. So maybe Head Start isn't improving more so than state preschool, but it might still be better than nothing. And so that's when I talk about comparing the effectiveness of different models. That's the stage we're at. Is it Head Start that you want? Is the California State Preschool Program, going to achieve the goals that you want?
Great. Thank you, Dr. Cannon. If there are no other questions, I'd like to thank you and invite up our next panel, which is from the Legislative Analyst's Office. We have Ryan Woolsey and Carolyn Chu, who are going to give us an overview of California's child care and development system.